This is Coach PDHPE. We're up to Core 1, Key Idea 1. We're having a look at the dot point, identifying priority health issues. There are the 5 relevant dash points underneath it, but we'll get to those in a moment. We're going to have a look at the overview of the actual dot point itself first. So how does the government decide how it's going to spend the mega health budget, which goes into billions and billions of dollars? It's critical that the health budget addresses the nation's most important health needs. These include groups that suffer inequity in health, for example, HSC and the socio-economically disadvantaged. They deserve to have their inequities addressed. Also, diseases that are preventable, such as cardiovascular disease and cancer, should also gain a high priority because of the high mortality rates of both of those diseases. To determine what needs the most priority is based on a set of criteria, and those 5 dash points and the dot point form the basis of those criteria. So the first of the dash point is social justice principles. Now, a definition of social justice refers to the idea of eliminating inequity in health and promoting supportive environments for all Australians. As a question to ask there, how does an individual of low socioeconomic status get adequate health treatment? Well, the idea of social justice says in this country we should provide Medicare and the pharmaceutical benefit scheme to provide cheap medication to assist the socioeconomically disadvantaged. So there are some principles of social justice. All individuals in Australia, as we said before, deserve equal opportunity at good health. Social justice recognises that those groups that are disadvantaged should still have the right to achieve optimum health. The social justice principles provide the framework so that these inequities can be addressed. There are 3 principles of social justice. The first is equity. Equity means resources need to be allocated fairly. In some cases, this means more money given and more resources given to groups that are disadvantaged, such as the money that's allocated to HSC in the health budget. Second, Australia is a diverse country. That's the principle of diversity. For example, there are many different cultures in this country, and accessing health information for some of those cultures where English is a second language proves very difficult. So the government attempts to provide translator services so that they can access health information. The third principle is supportive environments. People need to be provided with support to achieve good health. An example of this is providing exercise equipment in local parks so that people have the chance to do physical activity. The next dash point is priority population groups. Australia's population has subgroups of people who have significantly different health statuses compared to the rest of the population. Some of these groups include Aboriginal and Torres Strait Islanders people. They have higher rates of diabetes, for example. The socio-economic disadvantaged, and also people living in rural and remote communities. Some strategies to help these groups include the Royal Flying Doctor Service for people living in remote areas, and also how the budget allocates 17% more funding per capita for Indigenous health. The next dash point is prevalence of the condition. Another critical issue to consider in identifying health issues relates to how common the condition is. Some key terms here is mortality and morbidity. And when it comes to those 2 terms, cardiovascular disease and cancer are the 2 biggest killers and need significant resources. The next dash point, potential for prevention and early intervention. A large percentages of diseases and illnesses suffered by Australians result from poor lifestyle. If effective health promotion can challenge these behaviours, then there is potential to lower the incidence of some of these diseases. A good example have been the successful quit smoking programs that have helped lower the rates of lung cancer in this country. And finally, the last dash point, cost to the individual and community. The cost of treating disease is enormous, and there's 2 key factors to look at. The cost to the individual. Some examples of this equal the financial cost of treatment and loss of employment that the individual may experience while off on sick leave. There's the emotional costs. Often serious illness results in the follow-up disease of depression caused by chronic pain. And finally, social cost. Many relationships, including marriages, do not suffer the heavy burden brought about by illness in a family. And finally, the cost to the community. The most significant cost is the funding of the diagnosis, diagnosis and treatment, and then care of the patients. If the combined cost of the individual and community of a disease is large, then there is a high likelihood the disease will be deemed a priority health issue. They are the 5 dash points for that dot point: priority health issues. If you require any further information for Year 12 PDHPE, you can visit www.coachpdhpe, or I can be found on Twitter at coachpdhpe.com.